Welcome everyone. Thank you for joining us today for a special co-sponsored webinar with NNLM Region 4 and Region 6. If you need closed captioning, you can just simply click the CC button located at the bottom of your Zoom screen. I just have a little screenshot right there on this slide. My name is Lauren Wittick, and I'm the Communications Specialist for Region 4, which is based out of the Eccles Health Sciences Library at the University of Utah. A couple of housekeeping items before we get started. We will be recording today's session, and just note that it can take up to 30 days for the recording to become available. However, we're going to send out the link to everyone who registered, whether they attended or not. We're also going to share a link to the evaluation toward the end of the session, and completing the evaluation is the first step to claiming your MLA continuing education credit if you're interested in doing so. We just ask that you please keep yourselves muted throughout the presentation. And finally, we ask that you enter your questions into the chat. You can do so at any time. There will be time for Q&A at the end of the session. And moving on real quick, our next Region 4 webinar is tentatively scheduled for January 30th, 2024 at 1 p.m. Mountain Time. And we're going to talk about library telehealth partnerships, lessons learned, and looking ahead. If you'd like to stay up to date with Region 4, you're very welcome to sign up for our email newsletter and check out our blog. That QR code on this slide will take you to our regional page, which is nnlm.gov/about/regions/region 4. Now, I want to welcome our fabulous guest speaker, Sarah Dotrieve. Sarah is an information specialist at the Rural Health Information Hub, where she's part of the team responsible for maintaining the online library, answering reference questions, and managing the news portion of the site. The content she primarily covers is related to agricultural health and safety, aging in place and independent living, doing research in and on rural areas, the opioid crisis, violence and abuse, and health along the U.S.-Mexico border and in the Southwest states. Busy lady. RHIhub is a national project, so even though it's based out of the University of North Dakota, she lives with her husband Evan and her 1-year-old son Noah in sometimes rural Ruston, Louisiana. More on that later. Sarah, the floor is yours. Let me stop sharing.
Thank you. Okay, let me get mine up. Let's see. Okay, can everyone see that pretty well?
Yes.
Perfect. Okay. So thank you so much for joining me today. I am Sarah. I'm from RHIhub. Like Lauren mentioned, we are a federally funded clearinghouse of information for all things rural health. And our overarching goal is to help people understand the strengths, but also the challenges that come with being healthy and providing healthcare in rural America. Let me get my slides to move. There we go. So before we go further, I do want to learn a little bit more about you. I'm going to launch a poll. So while you answer this, basically, I just want to know kind of what your background is. Are you a librarian, a healthcare worker, some sort of human services provider? Maybe more than one of these options fit for you. If that is the case, pick the one that either is more related to what you do in your day-to-day or whatever brought you here today. While you answer this, I will give you a little bit more about my background. I spent nearly 10 years as an academic librarian, primarily in community colleges. A few years ago, I moved to work with a nonprofit as their librarian. They were in the agriculture, health, and safety space. And so I maintained their content and did some website management, some instructional design. I produced a podcast and a whole bunch of other things. And then earlier this year, I joined RHIhub as an information specialist. And I add and maintain content to our online library, which we'll look at in a little bit. We have several information specialists, and we all maintain certain content. We all have groups of states that we maintain content for. So we'll talk about all of that today. We also have a resource and referral service. This is what librarians call reference. We'll look at that in a bit too. Okay, Lauren, if I hit end poll, is it going to show everyone everything? It's fine if it does.
I don't think it does, but I
Okay.
can read it off to you if you
No,
want.
that's
You got
fine.
it?
I'll just
Okay.
say we are 68% librarian here. So that's mainly what I wanted to know. I suspected would primarily would be librarian. We have a couple healthcare workers, some people in academics and research, a couple of government employees, and 4 people who are mysteriously other. So thanks. That's really helpful for me to know. And then I'm going to launch a second poll. Got a lot of things open on the screen down here. Okay. Oh, I can't show results. So I'm going to move on from that. And then, how familiar are you with common rural health issues? While you answer that, I'll kind of run through what we're going to talk about today. If you were in the Rural Health Resources presentation earlier today, you will hear some familiar things, but no worries if you weren't. We're going to cover the important stuff again really quickly. If I were to ask everyone here, what are your opinions on being healthy and American healthcare, you could probably start to imagine the types of issues that would be brought up. At RHIhub, we're thinking about these issues from a rural perspective. All of the content that we curate and create is done with the idea that whoever's consuming that piece of content will end up better informed about how the bigger issues are experienced in rural areas and by rural people. In a minute, we'll talk about what some of those major topics of discussion are. But I will say you're not going to leave here a rural health expert. What you will be able to do, though, is be a little more familiar with what those major issues are and how you can learn more about them using our website. And it's going to be stuff that's relevant to either you or your community or your state or whatever. And I'll also mention that you will have access to the slides. We're going to look at a lot of stuff today on our website. So if you miss a link or forget how to navigate to a place, there should be a link on the slide to help you get to wherever we were talking about. Okay, let's see. We are pretty close to 50-50. 18 people familiar, 16 not very familiar. So that is also good for me to know. All right, thanks everyone for participating in that. Excuse me. Okay, so let's set the stage regarding rural health. Rural residents experience health disparities compared to the overall population. Rural residents have higher rates of mortality. They're less likely to be insured. They have higher incidence of disease, higher incidence of disability, and higher rates of chronic pain. And the reason for these disparities are very complex, but we can look at some of the big picture reasons for the disparities. And the first and biggest one is access to healthcare. Barriers to care are found in many spots in an attempt to receive healthcare. I already mentioned that rural Americans are less likely to be insured than the general population. So rural patients have to think about who they can see and how they can pay for it. But even if you have insurance, there are healthcare workforce shortages all across rural America. So it's not just as easy as popping into your local healthcare clinic. There are shortages in primary care, mental health care, dental care, maternal care, and more. Specialists are also less likely to be practicing in rural areas. Often these places just don't have the volume that a specialist needs to practice, and so that care is going to require transportation to access. Which brings up another important barrier, and that's distance to care. When you need health care and you don't have what you need in your community, getting to that health care can be expensive. We could be talking about money, that's, gas in your car if you have one, a hotel room, but we could also be talking about time. Not everyone has paid leave from work, and if you are a farmer, for example, and it's harvest season, taking an afternoon to go to a doctor, it just isn't realistic. A second reason for these disparities is socioeconomic status. You may be familiar with the term social determinants of health, but if not, these are the conditions that people exist in that impact health and quality of life. Social determinants of health consider housing, poverty, environment, education, race and ethnicity, and so much more. We know that rural residents are more likely to have lower incomes, substandard housing, live in food deserts, and more. And all of these conditions can lead to poor health. And when you live in a place where healthcare access is difficult, like we just talked about, this is going to lead to poorer health outcomes. And I'll note that these issues that we're talking about are not unique to rural areas. Urban areas also have uninsured people, workforce shortages, poverty, and all of the things that I just mentioned. But you can see how when you put all of these issues in a rural place where access is difficult, the impacts are just compounded. And that's how you end up with disparities in health for rural residents to begin with. So I want to reiterate what I said earlier. The reasons for these disparities are complex and nuanced. This is a very, very fast overview of some of the issues, but there is much more to be explored here. If you want to read about more of these topics at depth, I really recommend our Rural Health Disparities Guide. I have a link to it here on the slide, but I will show you how to get to that in just a minute. So there's 3 areas of our website that I want to talk about first, and we're going to start with the online library. So I'm going to switch to our website. Let me jump to the front of our website. The online library is the foundation for most of what I'm going to show you today. And we're going to work mostly in this navigation menu. So let's start with the library. If I hover down here, there are a lot of different options for things that you can look at. But if you just click online library, you can see them as well. And this will give you a sense of the types of things that you can find in our library. Funding and opportunities. This is a really important section of our library. We'll talk about that in a little bit. You can also look at the latest news and events that are coming up. We also offer a list of important players in rural health, state agencies, nonprofits, research centers, that sort of thing. And then, of course, we have a wide variety of resources. These are going to be thousands of reports and videos and articles and toolkits and podcast episodes and everything. So from this page, you see lots of options for browsing the library depending on what you're looking for. I'm going to look at resources by topic just to give you a sense of how many topics we cover in our library. You can see it really is extensive. I'm going to open up American Indian or Alaska Native. So these are all of the American Indian or Alaska Native tagged resources in our library. And make note of these blue boxes up here. This allows you to filter the list further. So if you wanted to look at, things tagged American Indian or Alaska Native and also Health Workforce Pipeline, you could do that. So you'll see these blue buttons allowing you to filter come up again and again on the website. You can also just search if you want to do that. If I type in mental health, this is going to do a search of the site, which includes our library. You can see over here the types of things that you could narrow to. Some of it I've already mentioned, the funding, the news, the resources. The other stuff we'll talk about throughout the presentation. But that's an option too if you prefer to search that way. Since we are a library heavy crowd, I will make note that we do regular review of every item in our library, every funding record, every resource, every organization. This is our weeding process. We are not in the business of archiving things. We don't keep things for history's sake or nostalgia's sake. There are certainly exceptions to that, but when something no longer has value to our users, we tend to let it go. So I say that so you know that our collection is actively managed. We add to it and take away from it daily to make sure that it is current and accurate. So I know some librarians would appreciate that. Now, browsing a list of links is maybe not the way that everyone wants to find information in an extensive online library. So I want to look at our guides as maybe an easier way to get some information, particularly if you don't have a strong background in rural health or a specific aspect of rural health. And you can do that in our Topics and States tab. So let's look at our state guides. All of our guides, topics and state guides, are meant to direct you to the best information we have in our online library. If you are familiar with LibGuides, it's the very same concept. So I'm going to open the first one, Alabama. All of our state guides have the same format. They're going to start with this sort of table of contents that is an entry point into certain types of information in the library related to Alabama. So you can see stuff we've mentioned: funding, resources, organizations, plus a few extras. If you scroll down a little bit, you're going to see the contact information for the State Office of Rural Health. These are really, really important players in the rural health field. So we like to connect people with them right at the top. And then if you scroll further, you're going to see some basic information about Alabama, some metro and non-metro data, some data about facilities, and then also some of that social determinants of health information that I mentioned earlier. And then I'm going to scroll back up and click the resources. Again, this is not all of the Alabama resources. These are the ones that we think are the best, that give you kind of the best overview into the rural health situation in Alabama. So I just want to make note of that. And again, you can narrow using these blue buttons. I will go back to our state guides page briefly to point out we also have guides for some territories and commonwealths, and then also state by state resources. So I just wanted to make note of that as well. Now let's look at topic guides. Topic guides, I want to look at them separate from state guides because they have a slightly different format. But this page right here is really, really great for getting a sense of what the major issues in rural health are. You can see some really clearly rural things. We have specific facilities that you find in rural areas. We have guides for those. Some things related to the rural healthcare workforce, for example. But you'll also find other things that maybe don't feel specifically rural. For example, we have a hunger and access to healthy food guide, an obesity and weight control guide, oral health. We have one for cancer, that sort of thing. These are things that happen in urban areas too, right? We are looking at the major issues with a rural perspective. So those guides are going to have really, really relevant rural information on them. So let's look at one of these. I'm going to open up violence and abuse, and you can kind of see what our approach to these topics are, especially when they're not clearly rural. So notice again, we have this same kind of table of contents box that we saw on the state guide. The big difference, though, is below. There's going to be a quick introduction to what this issue is. And then we have our FAQs. So you can look through the FAQs and kind of see our approach to talking about these topics. We're going to talk about what the rural angle is. How does this impact a particular group of rural people? What are the barriers to care for this issue in rural areas? These FAQs are filled with data. They point you to more resources for reading and learning. They point out best practices and where they're being implemented, things like that. So these are developed based on actual questions that we get. So there's a ton of really good content in here that people are actually wondering about. If you have a question and you don't see it on a guide, we can still help you with that, and we'll talk about that in a bit. Again, these guides are meant to give you the best of what we have in our library. So I'm going to mention this box again. Don't skip past it. This is a really good way to find the best of our funding, of our resources, upcoming events, and that sort of thing. So really pay attention to that box. Excuse me, I have a little bit of a cough. I apologize for the constant breaks. So these are our guides. This is a really great way to engage with an issue on our website without that sort of fire hose of information approach that the online library might give you. If you have a question about a rural health issue, I really recommend that you start on a guide. I mentioned earlier, I'll say again, they bring a lot of value to people who aren't familiar with a particular rural health topic. So since about half of us are not familiar, I want to give you a few minutes to look through our guides. We're only going to take about 2 or 3 minutes, but pick either the state guide for the state that you're in or a topic guide that looks interesting to you and see what you learn. I will stick in the chat, I will put the link to this page. So pick a guide. Maybe you read an FAQ, maybe you find a resource that you find really interesting. Just kind of poke around and see what you find. My clock says 2:23, so we'll come back at about 2:26. So I'll give you a minute to look. And if you find something interesting or you learn something that you didn't know, stick it in the chat. I would like to see what it is. Seeing some things come in. Awesome, Kelly, learning something new about your campus. George asked a really good question in the Q&A, and I want to go ahead and mention it. We have put a lot of effort. I need to give a shout out to the people on our team that think all the time about how things appear in Google searches for our site. They do a fantastic job, and I am constantly shocked if I Google something and don't look for it first on our website. We are like always on the first page. They have done so great at this. So the answer, George, is that yes, it typically is pretty easily discoverable in general Google searches. That doesn't mean you're going to get everything. And of course, it's going to be, with other stuff as well. But I'm constantly impressed with how highly we rank for things. And there are some, SEO things that we do to try to make sure things stay that way. If you have any familiarity with SEO, then you probably know what some of those things are, but that team does a really great job. I still recommend our site. I find it easier to find specific types of information, like if I'm looking for funding or looking for events and things like that. I find it easier to use the site. Okay, so we're going to press on. I see some things in the chat. David, I love your mention about the parishes in Louisiana being metropolitan. We're going to talk about that in a bit. I find rural definitions to be really interesting, so I'm glad you brought that up. Something I've been learning about recently through our guides. I have been reviewing and editing our community supports for aging and independent living guide recently. And I've really been struck by the health impact that isolation and loneliness can have on people. This is a really significant problem in rural areas for elderly and people with disabilities who may not have access to the social engagement that can be easier to get in more populated areas. And you might have heard earlier this year, the Surgeon General released an advisory about the loneliness crisis in America. This is an example of an issue a lot of people face, but can really be exacerbated by being rural. So that's something that I've been reading about, and I'm definitely going to read back through the chat. So keep putting stuff in. I want to know what you learned. In the meantime, we're going to press forward. I'm going to pull my slides back up for a minute. So what we've talked about so far is mostly how to get familiar with rural health topics if you're not already. But many experts still come to us with some aspect of rural health, like a really particular answer that they need. And so I want to talk about how to do that using our content. So there's 4 questions that we are going to research today using the website. We're going to answer the question, is my town or zip code or county rural? What are the recent social determinants of health-related statistics for Nebraska? Do you have mobile healthcare unit policies that I could review? And where can I get a grant for dental equipment for my clinic in California? So let's get started. We'll pull the website back up, take a quick water break. So the first question, is my town or zip code or county rural? This probably seems like a question with a really simple answer, which is yes or no, but unfortunately it's more complicated than that. Luckily, we have a tool that you can use to get really close to an answer for that question. But before we look at the tool, we need to talk about how rural is defined in the US. I'm going to give you a quick summary, but we have a topic guide that looks at this in depth and it's phenomenal. So the reason that there isn't a direct yes or no answer to this question is that there are multiple definitions of rural. And a really important step in getting an answer to your question is deciding what definition that you're using. So there are three primary definitions. They come from the US Census Bureau, the Office of Management and Budget, and the Economic Research Service in the USDA. And they use different factors to determine what is rural according to their agency. So some of it is based on how people commute for work. Some of it is based on the number of housing units in a square mile. There are a lot of different factors, and it's not just simply how many people live in a place like you might expect. So this guide is a good way to dive deep on that question, but I want to take you to a particular table. It's in the second FAQ, and it gives a summary of these rural definitions. So I'll let you look at it for a second. Make note of the geographic units used. So census blocks or block groups, county or census tract, zip code approximation. This gives you a sense of how people are defining rural. And a lot of times your definition is probably going to be based on what type of data you have. If you're looking at counties, then that's going to determine what sort of definition you can use. I will say, if you need this answer for a grant or some other type of program, very often the definition that defines rural for that program will be outlined by the program. So sometimes you may not have to decide for yourself. So we're going to look at the tool that we have, but before we do that, I want to talk about two places that I've lived, and we're going to talk about how to define them, how they are defined. Scuba, Mississippi, and Ruston, Louisiana. So I've got a couple data points here about each place, so you can kind of get a sense of their size. Scuba, 744 people in the last census, 2.5 square miles, a very small place. Ruston, a little more than 22,000 people, a little more than 21 square miles. So let's use the tool on these two places to get a sense of how rural is defined. You can get to the tool from the homepage. We have this Am I Rural tool block here. You can also get it in the Tools for Success. So in this box, you can put a zip code, you could put a town and a state, you could put a county, you could put an address. I'm going to type in Scuba, Mississippi, and click Run Report. So I'm going to scroll down to this Common Rural Definitions box. You can see it's a little long. I'll have to scroll a little bit for all of it. So let's look at what we notice. Scuba is very rural, 744 people, 2.5 square miles. You're probably not shocked to see that it's going to be designated as rural by a lot of places, not in an urban area. In the 2010 census, 100% of the county was designated rural. It also has a FAR level. Not every rural place gets this. This is for the more remote or frontier places. However, despite the incredibly rural nature of Scuba, I was surprised to learn that it is classified as micropolitan, by at least one definition. And that's because of Meridian, which is about 35 or 40 minutes away. It's very weird to think about a town of 744 people as micropolitan, but that's rural definitions for you. Let's look at Reston next. So I'm going to scroll down. Reston is a great example of rural not being really clear cut. We're 22,000 people. In the 2010 census, the parish, or the county equivalent for Louisiana, was almost 41%. So 41% of the county was designated rural. You can see that it is designated rural by the Federal Office of Rural Health Policy. But you can also see we're located within an urban area for the 2020 census. So again, if a place is rural or not is not a yes or no thing. It really depends on what sort of definition that you're looking at. There are a lot of really good reasons for this. It may not seem like it if you're just trying to figure out if you're rural or not. But that's why this tool is so useful, because people very often are like, I'm not sure if we're rural or not. You can come here and this tool will tell you. So use the tool, put in your address or your zip code or your town and see if you're rural. And if you see something surprising, let us know in the chat what it is. I'll also mention that this help button is here, which is really great, particularly for a refresher on rural definitions. If you scroll down, we've got common rural definitions, and you can open it and it will tell you how it defines rural. So that's a really great thing to know about. Okay, I'm going to move forward. Let's talk about our next research question, which is, what are the recent social determinants of health related statistics for Nebraska? Now, I talked about social determinants of health earlier, but I want to go to the social determinants of health topic guide so we can kind of talk more about what they are. And right in the introduction, we have a really quick list of some really common determinants. So let's think about employment. Very often health insurance is tied to your employment, and so your job is something that impacts your health. That makes the job the social determinant of health. Housing is another. It's not just enough to have a house, though being homeless certainly can impact your health, but also, is your house safe? Is your house safe? If it has mold, for example, that's going to impact your health. So housing is a social determinant of health. These are the social factors that contribute to either better or worse health. And for some social determinants of health, the impact is disproportionately felt in rural areas when compared to urban ones. So let's say we want to look at that data for our states. Before we move off from this guide, I'll mention again this table of contents box here. For some of our guides, there are charts. And so this is one way that you could get to this data. You'll notice some of these have state versions available on them. So you can open up a chart. We'll take this one, and then you can choose your states out of the list. So if I choose Nebraska, we're going to get that information. And again, a lot of the charts have this information. So you can see here, there's a lot of good data here. Now, say that you don't want to come to the site, go to a topic guide, find the social determinants of health, go to the charts, narrow by state. You can also go to rural data visualizations, and I'm going to go to the Data Explorer. Okay. The Explorer defaults to the first indicator of the list, but we do have a social determinants of health section here. So if you want to look at that, you can. Let's stick with poverty. This is interactive, so you can look at a particular state. We go to Nebraska. we can also see within these counties. And if you scroll down, it's going to give you the metro and non-metro information for the state and for the counties in the state. And I'll just come back to this list. There is a lot of information in this list, a lot of data. So this is a really great way to get some quick numbers if you need that. While we're thinking about data, I'll point you to a couple of other spots that you can get data from our site. Back in the rural data visualizations dropdown, we have chart gallery and maps. And then there is also an excellent topic guide, finding statistics and data related to rural health. This is an excellent guide for a lot of reasons, one of them being this table right here. So I'm going to open up this data sources and tools relevant to rural health table. This lists some of the most commonly used places for rural health. You can see we have what the source is, what it covers, kind of what the data looks like, the geographic level of the data. So if you need something, you know, like a zip code, this one goes all the way down to that, and then how frequently it's updated. So this is a really great tool. If you have a data question, but you're not sure of the best place to get the answer, this is a great place to start. Okay, let's talk about the third type of request that could be answered through our website, and that is the question, do you have mobile health care unit policies that I could review? This was a question that we recently got, and I want to show you how I answered it using our website. So somebody emailed us to say they had received a grant for a mobile health unit, and they were looking for some example policies that they could review as they work to implement the components of the grant. Now, we don't have example policies, and I did look in the online library to make sure there was not something that we had come across at some point that gave example policies, but I didn't have any luck there. That doesn't mean that we don't have stuff to share. So I want to show you what I was able to share with them. We did have a few articles that were kind of the, here's how we set up our mobile clinic variety in the library, and so I shared those. But there were two other things that were really, really helpful. And the first was our models and innovations. So here in our case studies tab, it's the very first drop list in the drop-down list. These are project examples that include information on implementation and replication. Our library currently has around 250 models that covers all sorts of rural health topics. And on this page, you can view the models by several different types of information, one of them being level of evidence. So this basically, we try to index things that are evidence-based or have proven effective in some way. And you can browse by, you know, what level of evidence that program has for their effectiveness. And if you want to read more about that, we kind of outline that on the criteria page. You can also look at things by a particular state or a certain topic. And so this is where I headed when I got this question. I knew that we had a topic that covers mobile and episodic healthcare delivery. So here we had 5 programs that were about offering mobile healthcare. And the great thing about our models and innovations is almost all of them include contact information for the people responsible for these programs. And they know that they're on here, and they are happy to answer questions from people who are looking to implement similar services. So while we didn't have policies, we did have the names of people who had implemented these programs and could help answer those questions. And then the other place on our website that I looked was in our toolkits. So I'm going to go to evidence-based toolkits. We'll just hang out here for 1 second. Our toolkits are fantastic. They are evidence-based guides for building effective community health programs and projects. We have over 20 of them, and they touch on all sorts of topics like maternal health and aging in place and health literacy and that sort of thing. I'll also call out our newest one, the Emergency Preparedness and Response Toolkit. But for this question, I went to our Transportation Toolkit all the way at the bottom. So in this toolkit, we have program models and then models to overcome barriers, and we had more information about mobile clinics. So this was another place where I was able to share with this person examples of projects that had been successful that they could use to get more information about how they were implemented. Okay, let's talk about our last question. Where can I get funding for dental equipment for my clinic in California? And we get this type of question a whole bunch. Our funding section of our library is very, very, very popular. So let's go into the funding. RHIhub does not offer grants or other types of funding. We just index the things that are out there. We have hundreds of them in our library, and they are like traditional grants, loan repayment programs, scholarships, loans, all sorts of stuff. Like other parts of the library, you can look at them by like topic or state. So that's really useful. Especially if you're looking for something like loan repayment. I'll look at the type for a second so you can see the different things that are in here. Loan repayment is really popular. And then also your traditional grants and things like that. The great thing about our library is that we offer, or we include, inactive funding records. And this is great because if you know anything about grants and funding, it's that very often they are offered on a regular basis. So by being able to see what's currently inactive, you can watch for it when it opens up again and have a head start on thinking about what you're going to use those funds for. So if we're looking for grants that offer funding for dental equipment in California, I'm going to select the grant type. I'm going to narrow by topic, and we have oral health in this list right here. So I'm going to scroll down and hit OK. And then also we have geography. So I want to point out a couple things. We have a California option, but we also have a national option. So make sure that you're searching both whenever you're looking for funding. If I open just the California specific ones, these are the 4 things we have indexed that could very well fit this request. And again, you would want to also look at those national options. And then finally, I'll mention 3 topic guides that we have related to funding. If you have more questions about how funding for rural healthcare works, we have an applying for grants to support rural health projects guide, a capital funding for rural healthcare guide, and a scholarships, loans, and loan repayment for rural health professional guide. That is a very fast look at our library. We are going to have time for questions. So if you want to look at something in more detail, start thinking about what that is. I'm going to wrap up by talking about ways that you can engage with us and keep learning about rural health. The first is our resource and referral service. So this is our reference desk, essentially. We are open between 8 and 5 Central Time. And during that time, we are manning a phone and an inbox where you can contact us and ask us whatever your rural health question is. We just talked about funding, and one thing that we often do through this service is custom funding searches. So if you have a project in mind and you're struggling to find a grant or a loan that might work for you, just ask us. We might be able to find something. The question we had about the mobile health unit policies came in through this service. So that's an idea of the types of questions that we get. If you go to contact us here at the top, you can get that information for how you can contact us. And I also want to talk about the things that you will find on this page. The Rural Monitor right here. This is our publication. We put out articles all the time. These are things that are written in-house by people on our staff, featuring programs, interviewing experts, that sort of thing. They put a lot of work into these articles, so I really recommend that you check those out. We also have a monthly podcast that is very excellent. And then we also host webinars, and we have videos highlighting different programs that we've profiled. If you are interested more about rural classifications, we just had a webinar that talked about the changes that are coming from rural classifications based on the 2020 census. So I really recommend watching that. It was recorded and it's here in our webinars section. There's another really excellent way to stay on top of what's happening in rural, and I want to go to our updates and alerts. First, we have RHIhub this week. This is an email that comes every Wednesday. It features new rural monitor articles that we've written, but also highlights some things that we have added to the library in the past week. You don't get a bunch of emails from us. It's just this one weekly email, and it is just full of the really exciting things that we found in the last week that you might want to know about. It covers everything that we cover, all things rural health. But the other thing that I want to make sure you know about are the daily and weekly custom alerts. I love this. You can get an email every morning or once a week, and you can get alerts for everything that we've added within certain topics. You can get everything that we've added if you're interested in that. But say if you are a dentist in California and you want to know more about funding for dental equipment, you can get exactly that. I can choose California, and I'm going to scroll to oral health, and that's going to get me funding records tagged with oral health in California. So this is a great way to stay on top of specific topics. If there's something that you're really interested in and you want to know new resources we've added or new models, this is a great way to do that. And then finally, I will mention, let me jump forward to the end. These are social media handles, contact information again. If you have any questions today or in the future, this is how you get in touch with us. So we love to engage with people who are using our stuff. We love to hear how they're using our stuff. So please contact us. We want to talk to you. And that is it for me.
Sarah, thank you very much. This is Jacqueline from Region 6, and I have noted a couple of questions for you.
Okay.
All right, the first one, is there any consideration being given to representing LGBTQIA+ information within the special population sections of topic guides? Especially within rural areas, folks within the LGBTQ+ communities are significantly marginalized, isolated. And then a great kudo for RHIhub. It is superlative.
We love to hear that. We have LGBTQ considerations throughout. I know that they are represented in our violence and abuse guide, because that's a guide that I manage. We also have content in our schools guide, I believe, and in healthcare access, I believe. It really is woven throughout all of our guides. Something that we talk about a lot is how to tackle specific topics. Do we weave it throughout? Because there's a lot of overlap on these topics. And so sometimes that's just a choice that has to be made. And then also we look at the resources that are out there that are specific to a topic, whether that's a population group or just a topic in general. And if there's a lot of good content where we can build a guide around it, then that's something that we might do. So that those are some of the conversations that we have when we're talking about, should this be on its own guide or built into other guides?
All right, thank you. And I noted on a general website search that there were 267 web pages related to LGBTQ+ issues. All right, for our next question, I chose the obesity and weight control topic page. Wow, very extensive coverage. Again, more kudos. I had also done a search for PubMed and noticed a canned active PubMed search for obesity. The PubMed search did not seem to be linked on the obesity topic page. Maybe I missed it? Is there a topic page for PubMed for healthcare providers?
There is not a topic page for PubMed for healthcare providers. We do have PubMed searches for all of our topic guides. So I suspect that you might have missed the obesity one. However, you never know. So I'm just going to make a note and make sure that if it's not there, that it's added if it should be there. In the resources, we do have a resource. Let me see if I can very quickly do it. Let's go back to violence and abuse. And if I go to resources, and I'm going to narrow by, I think it's going to be this literature search. Yes, PubMed search for domestic violence and rural health. So all of the guides should have that. So it's definitely in the resources, if not on the guide itself.
Okay, thank you. And we have a question from David. Has RHIhub presented at any state library association conferences?
I don't know. That's an excellent question. I started working here in March, and I know that we have not since March. Prior to that, I don't know. If you are ever interested in that, we do take presentation requests, and our management team will look at those and decide what we're able to do. But if you can just contact us in the resource and referral service, and we are very happy to get you an answer to that. If you genuinely want to know, send us an answer, a question in there. I can grab that email and I can find out for you, and I can respond and let you know if we have presented in the past. My supervisor has been with RHIhub forever, and she would know.
Okay, those are all the questions I see right now. If there are any others.
If not, we can wrap it up.
Yeah, that's fine. I'm just looking back at the chat and seeing the things that y'all learned. I'm so glad. I'm so glad that you're finding things useful. So yeah, please contact us if you have any questions. We're very happy to talk one-on-one with you if there's something on the site that you need help with, or some data you're looking for, or whatever.
Great. Thank you so much, Sarah. We really appreciate your time and your sharing your expertise. This has been wonderful.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.